my next speaker is very dynamic. This is Mr. David Kent. David is a presenter extraordinaire in the United States. He's an incredible educator. He's also a tremendous motivator, as you are about to find out. I think things are about to get a little exciting for you. Yeah, I really do think so. I'm going to break into song in a second because I really do think so. It's like an Alanis Morissette song, right? So the thing is, I hope you're learning stuff. I hope you're taking away stuff that you can use in your practice. I hope that the time that you've spent here, sitting here in these seats, is going to be all worth it in just a few moments. And after David is done, please don't get up and run to the hall yet, because we've got to give away the grand prize. Behind me, we're giving away this whole package. So if you're still in the can I get a woo-woo for that? All right, so without further ado, I would like to introduce Mr. David Kent, my dear friend.
Hey, how y'all doing? But anyway, what we're here to learn about is systems for setting up your practice. And here's how I came about creating systems for setting up my practice. I couldn't make a freaking living in massage when I first got into massage. Here I was, a guy in Redneckville down in Florida. Got out of massage school because it helped me out with massage. I was really sick, and massage helped me, and I thought, this is awesome, I need to bring this to people. So I go to massage school, I get out, and all they want to know is, what's wrong with you, boy? You sometimes a bad or something? I'm serious, they said it to me. I mean, why would a guy want to touch another guy? I don't understand that. And you ain't going to touch my woman. No one's going to touch my woman. Unless their woman was in so much pain, it's driving Big Bubba crazy, that he's more than happy to bring her for treatment, but he's going to sit there and watch me. Because you're touching my woman. So I was having a hard time getting people to schedule into my talk, because I was a guy who read everything. Then I realized, boy, if I just came and implemented a few systems, because what I realized is, you know what? Seems like women don't have trouble going to a chiropractor. You know, it seems like women don't have trouble going to a male gynecologist. You know, there's all these male doctors that they go to, and now it's a massage therapist. Or if they did let me work on it, it was like really great, you know, it really helped them, and I definitely want to come back, but they never come back. Or they come back once, and I mean they come back more than once to pay my bills. So then I started to have, so what I started to do was just evaluate the systems around me that were working in the medical profession, working in the chiropractic profession, working in acupuncture profession. It was like working in all these other medical, in all these other professions that related to healthcare, but those systems didn't really exist in this health. So what I started to do, and I loved what I was doing, but I had to start creating systems for myself. Originally, I didn't design these thinking, oh, I'm going to run out there and take them out of it. I was designing this for myself to make a living. I was designing this for myself to make it look like I knew what I was talking about when I was in the treatment room. So you've got to develop different systems for yourself, because people are going to call you. Sometimes you're going to have neck pain, sometimes you're going to have headaches, sometimes we're going to have lumbar pain, whatever it is, neck pain, headaches. But once they get to you, you've only got so much time, and they've only got so much money. And you need to make it happen in a very short period of time. They might only have 45 minutes, 60 minutes, whatever it is. Of course, they all want the 30-minute treatment. You know, they wait until they're in crisis, then they go, do you have a 30-minute treatment? No, I do not. Anyway, so I had to come up with systems to assess. How do I get the information where they can fill out different forms for me when they came in? So systems to assess, you need to come up with systems to evaluate them, and then you need systems to educate them, because that's what happens when we go to a doctor. I mean, when you really stop and think about it, when someone finally gets around to scheduling an appointment, they're in pretty bad shape. You know, there's echo. Oh, girl, stop. You ever see that? There's an old Tom Cruise film. Go on, girl, stop up. But anyway, so people schedule an appointment, and what I started to do was think about the medical model, okay? You schedule an appointment, you go to the doctor's office, and you start reception room, right? Start in the reception room, they take you back, they do some weight, they run some blood pressure, and then you sit in the exam room, wondering what's in the drawers, right? What's behind the doors? And is anyone going to finally come into my room, you know? Okay, then they start a physical exam. They look in your ears, they look in your mouth. Most often they prescribe some medication, maybe they add some therapy. Does this all make sense? Then typically they'll follow through, they'll take some imaging. I'm not allowed to get too close to that. I just remember, I'm used to wandering around. Okay. And they may order more imaging. Okay, they might order more imaging, and then they always give a report of findings. You know, the chiropractor has a report of findings, they go all over the x-ray. The dentist, they do an exam, they might tap on the tooth that's bothering you, blow cold air or water on it. Have you ever had these things done? Okay, those are all their assessments. And then they take an x-ray, which is their imaging, and then they hold it up, and you know what they were looking at. And they start to tell you about it. You can all relate to this, right? That's something we're not doing in massage. You know, they typically, in the end, and what they did for me, because the way I got into massage is I was very ill, but mainstream medicine didn't have answers for me. So I had limited options. For me, it was pills. And surgery was my other option, and then I'm just going to have to learn to live with the pain that I had. Today I take no pills. I never had the surgery, and I'm fine. So subconsciously, that's the key. Everyone's brainwashed before they get to your clinic or before you get to their house if you're doing an alcohol of what they subconsciously expect from their healthcare provider to do to them. And I know most often when I went to a massage therapist, I told them I had neck pain or back pain. They say, you know, take out your chair, lay down on the table, I'll be in a minute. You know, that was about it. Sometimes someone would have me move my head around, but there was no assessment, education, report of findings, laying out a treatment plan. So that's advice. And basically, when they gave me a report of findings, it was like listening to an old radio. There were no visuals. You know, they would talk to me. They tell me I've got trigger points, my posture is really bad, I've got terrible muscles, you stand like this, you're holding your shoulder high, and they're just telling me that. And I'm listening to the person thinking, you know what I'm saying. I'm kind of wondering. I didn't have a lot of, they were just kind of talking now. There again, it was surgery or it was massage. Otherwise, if it wasn't like surgery, I wouldn't have hung in there with my massage therapist. Sometimes my massage therapist would get really dynamic. They'd bring a book in. And I would think, they're looking at a book, that's like on the mechanic looking up how to do something. You know, I didn't feel like that was like, I mean, how many times has the doctor walked in and put the book open and said, yep, it's right here. I mean, if they have to leave to look it up in a book, that means they didn't know, right? I mean, can you see how I could take that subconsciously? So when they came into me showing me a book, I was like, this isn't good. It's just, I looked and I nodded my head, but in my gut, it didn't feel like they owned the material. Or else what they do is they start talking to me like it was geometry or something. They start talking about sternocleidomastoid and your inflection, and you need to get more of an extension, and I didn't. Okay, that didn't work for them, but they were just talking to me on a radio about what needed to be done. Very little intake was done. And at a certain point during my treatments, I started thinking, I don't know if this is helping. And I was almost going to quit. And the therapist, I hung in there, and then the other option was surgery. I didn't want that. So I started, everyone here's a student, right? But even if you're a student, it happens. Have you ever had someone tell you, it's my right low back? And then you go to work on them, and you're working on their left low back. And they tell you it's the other side, and you go, I know, but I want you to check the good side first, because that's what you're supposed to do as part of physical assessment, which technically you are, but sometimes I just downright forgot. Have you ever had that happen? If you haven't and you do enough therapy, it will happen to you. Or as you're doing 6 treatments, you start to get in there, and even though they told you, it's like, was that the right shoulder? And what back? Was that the last time? You know, that type of stuff. So now what I do is I have them color in when they come what hurts. Seems silly, Mark can always have clients that will just circle the whole body in X10, you know, on a scale. You will get that. But some patients will actually color in the areas that bother them. And then I have them rate, like their headache when they came in was 8 to 10, their neck pain was 8 on a scale of 1 to 10, understand their 6, 10, 7 pain, 10 on the low back, and then they mark again when they leave after treatment. Why I do this is so that as I progress through treatments, can you tell that there's a difference over a period of 4 weeks? Yes or no? Yeah, just by looking at the picture, because the picture is worth what? 1,000 words. If I need the doctor to give this person a referral, I can even fax 2 pieces of paper to the doctor. They can look at it and tell they're doing better, right? And here's what's interesting. If this patient walks into the doctor, 9 out of 10 times, I guarantee you, the doctor said, how's your back pain? Well, I still got a spot here on my back. Some people just always talk like this negative talk, like today is still as bad as it was. Sometimes your client will tell me, well, I'm not sure if this is helping. But if I whip this out and remind them where we were, you know, just 3.5 weeks ago, now I brought them back, and I didn't make this up. They made this up. Are you with me? I'm just reminding them the story they've been telling me. I'm not, you know, this is all subjective on their part. I can also, if they have headaches, you should have a system where you're taking like a headache diary, something like that. So, like, you can tell over the month they fill less blanks, or, you know, there's more blanks. There again, if I fax those 3 pieces of paper to the doctor, even though they walk in and they go, doctor, last week I had a terrible headache, I had to take an injection, a Minitrip, you know, the doctor understands you're still getting better. Because people are always stuck, you know, they just lose perspective. So you want to have systems of doing that. Now, there again, you also need to have other systems to assess besides what they're filling out. So I'll look at posture, because really, posture or the body, what's the name that we give to the body when we're talking about form of the body? Yeah, anatomy, right. Yeah, when we're talking about anatomical terms, we look at form and we look at function. So we need some balance. When I got into massage school, I didn't even know what that symbol was. I swear to God, I had no idea. Yin, yang, you know, whatever. But really, it's talking about balance. When we talk about balance in the human body, homeostasis, we're typically a doctor, like when I was looking for biochemical balance. They were drawing blood all the time. They weren't looking at structure. So you can real quickly look at someone's structure by looking at their posture, because their anatomy, their form, affects their physiology, their function. Actually, that form will affect their psychology. And let me give you, if I told you in the back of the room around the corner there was someone crying for $1 million Canadian, where do you think their head is? Up or down? Down. Where are their eyes? Up or down? Where are their shoulders? Back or forward? Forward. Why do we know that? One, you want to take a crack at winning $1 million Canadian. And the other reason is you've done it. There's an anatomy for trying. So there's a certain anatomy that affects your psychology. So your psychology affects your form and function and vice versa. So I want to make sure I'm getting balance in the skeletal system, the muscular system, you know, that's all going to affect the nervous system and the lymphatic system. But bottom line, we need to get balance of this whole body, and you need different systems to do that. So what we do is when someone comes in, we take a moment and we just stand in front of a chart so we can take a photograph of their posture. And to them, the photograph is nothing more subconsciously than imaging. Does that make sense to you? They know we've taken a picture. To them, that camera is an X-ray, an MRI, a CAT scan in their mind. That's what the healthcare provider does. And how many of you have a cell phone with a camera on it? Raise your hands. That's what I use now. You know, first I had this Polaroid camera in the old days. I'd hit a button and then this square would come out and it'd be black and we'd be amazed as it changed colors over the next 3 minutes, you know? And then the little cameras came up. Now with my cell phone, I can snap a photo and zoom right in and show them what's going on. So what we do is we take the person, we equally space their feet from center line, very important. And I don't line up the toes, I line up the back of the heel and the inside of the heel. Space the feet about shoulder width apart. Okay? The reason why I don't line the toes up, if I line the toes up on a line, and they had polio maybe as a child, they got a 9.5 on one foot and maybe an 8 on the other, it's going to create a torque in their body. Does that make sense? Some people will say, well, shouldn't just have to put their feet however, what's normal for them? I need to put it back in a place that I can take a photo time and time again and see change. So it's the heels. The back and the middle, the medial aspect of the heels. No, it's not. Why is this not moving here? So real quick, if I stand someone there, see how easy it is? You can see one foot's a little lateral, that one's a little more laterally rotated than the other. As we start to move up her body here, one arches forwards. See her hand? See how her hand's in front of her thigh? That's only happening because of the fallen arc on this leg. So it's pretty easy here to see, you see the back of this hand, see more space in there. But that's all of what we're looking at. It doesn't take us very long. And we can move right up the body. Can you tell that one shoulder's higher than the other? Okay? That's what we see as a therapist. And then we're telling the person. But you just can't tell them, you need to show it to them. So remember, that picture is like an MRI or CAT scan to them. So when I take my camera, or I take my okay. Thanks, Bruce, I appreciate that. That was perfect. Just continue to do that. It's okay. But I'll take the camera, and if I was holding the camera in my hand, I would just show them and say, can you see more white space on this side than that side? Yes or no, I ask. Can you see it, yes or no? Yes. Then can you see more on the back end of this one? They'll say yes. And then when I bring them up, I say, can you see that your head and your body has moved off from midline? Yes or no? Of course they can see, you know? But I want them to say yes. It's much different when they've acknowledged it. Is this making sense? If you're doing an outcall, you just take a chart and hang it over a door or something like that. But this way, I'm building a case. I'm showing them, hey, look, it makes sense that you've got all this pain on the right shoulder. That's your right shoulder. Does that work for you all? You know, I can explain all the pain that's going on if we look at her here from the lateral. You know, you just line up, when you turn them laterally, that plumb line needs to hit on the anterior aspect of the lateral malleolus, okay? That's where we start. People talk about the relation of the head to the shoulder. It's all starting down at our base. Is this making sense? And then where do we go as we move up? So we can continue to follow it up, but as we come up, you see fluid? Well, I'll do it here. We shouldn't be seeing this hand coming around the body. That's all part of the twist. And then I say, can you see, but they can't see this picture. All I can do is show it to them there. But then they see that they've got a forward head posture. This is all making sense to you? Okay, so You've got to come up with some system for a report of findings, okay? So I end up using trigger point charts. Know that if you have anything that's laminated, you can draw and write on it with a wet erase marker. And that's what I do. So you see here, Raven's just going through and circling the chart, explaining all the trigger points to someone, because we created a system on how to do it. So it would be very easy for any of us to start working with someone. So we came up with systems there again of educating them a little bit more on how the trigger points, how the posture, you know, they had pain, they colored it in, posture totally supported the pain that they colored in. Now we're going to talk about the trigger points. I then go over to a skeletal chart. I take to, remember how her foot was laterally rotated? This is like me drawing on the X-frame to them. And then remember how she had one hand that I could tell that hand's aiming normal. There was a little more space on this side. You had a low shoulder on the left. It doesn't take me very long to explain it to them, does it? You know, this hand rotated in. Now I'm going to explain that you got, then we're going to go to the side view. Oh, remember that her head was off to one side. And then we had the one shoulder that was further back than where it should be. That's part of the rotation. And then her external auditory meatus was forward. They get this, but as I'm drawing it, I'm kind of designing my treatment plan right in front of them as I'm giving them the education. I can move over to my muscular chart and do the same thing. Start drawing on it to let them know what, even though they've got a headache, part of it comes from the rest of their body. So it's how do you create a whole system? And I'm just letting them know, maybe the muscles have pulled down, and is this all making sense? So you want to come up with different systems. I even color-coded things for myself so I could find the trigger points quicker. Like on this, the X is the most common location of the trigger point. The red shows where the referral patterns go based on Travell's and Simon's research. But here's my little trick. I hang all my answers right on the wall in front of me. See these little color boxes? That's because a trigger point like this goes through 5 different color zones. Are you with me? So when I start to get to my chart, and I'm certain if someone said, oh, I've got pain in my temple, you just start looking for, I'll go back one slide. So if they said I've got pain in the red area, all I got to do is follow all the red dots and circle the muscles with the red dots. Is this making sense? And then I even lay them out in columns, so all the muscles on the back of the neck are in one column. And we're doing that. But as I'm going through and I'm circling the chart, I'm also preparing it because if these are all the muscles on the back of the neck, superficial to deep, and I tell them, here's the trapezius, that I'm going to work on, the next muscles, I tell them, this is a few layers deeper. I may not be able to work that deep on you today, but we'll see. So what if I just subconsciously laid into you? If I told you I may not be able to get to those deep layer muscles today, basically what have I said? You're coming back! I'm not even being able to inspect it all today. I don't even know. We've got like 4 different layers. I will get as deep as I can, but I won't know until after treatment whether I can, because it's true, you may not be able to get that deep into someone's suboccipital. So there again, as I'm educating them, and all this happens, I do it all within 5 minutes. I look at the posture, when we looked at it, it takes less than a minute to shoot a front view and a side view. It takes 32 seconds, as I timed it, for me to draw on the skeletal chart. It took another 28 seconds for me to draw on the skeletal, then I do the muscular. And then it takes me about a minute and a half to go over the trigger points. Because this is the pattern if they pointed to the red area, if they had pointed to the green frontal headache, then I got another pattern that I follow. I think I'm out of time. Oh, she was coming at me. Okay, so I want to say thank you. I want you to know that when you start this process, they don't know any more than you do. So when you start to look at posture and you're not sure, they go, what does it mean? Just say, I'll tell you later, because I'll never get back to it. And the other thing is, you just need to get out there and
you bring us stairs.
The other thing is, you just need to get out there and start doing it. You just have to start doing it. You just got to determine, here's the way it's going to run, here's the way I'm going to run my practice. And you know, was your first massage as good as the one you do today? No. So there again, you got to practice the process of educating the clients. Yes. Yeah, Yep, you can find us right over in the Massage Warehouse booth. We've got like this, all the different charts there. And there's one that's a mobile version. I got like a flip chart. So you know, when I'm doing outcalls or meeting with physicians, I take the flip version of it because it has all the same pictures. Okay, we got to give away some